stuff. What skills do you recommend people pursue to prepare for disaster medicine and all this?
Oh, geez. Oh, wow.
We have a
Where do we
huge,
start?
a huge list.
I have a list that would be several pages long. I mean, you need to know how to perform a basic history and physical. You take vital signs, pulses, respiration rates, blood pressures, things like that would be useful.
Know what things sound like and what things should feel like.
Right.
And you know if there's something that's, kind of off. And
Right.
comparing both sides of a human is great. Like, oh, this is a little higher than this side. Maybe we
Right.
have a problem. This finger's going in a different direction than the other fingers. So there are clues to know when something's wrong, but you should know what things sound like and what they feel like.
You should know how to deal with orthopedic injuries, you splint, pad, and wrap, let's say, a sprain. You should know how to close a wound with various different methods, glues and sutures and things like that, and when to leave it open.
Yep.
We have a number of USBs and videos on our YouTube channel that teach you when to do it, when not to do it, because that's very important. Let's see, how to identify things. That's important. That's really important. I mean, you need to be able to identify when somebody's got a cold and when somebody has pneumonia.
Right.
There's a difference, and you could tell simply by listening to somebody's lungs, and there's an obvious change. And we have, I think our survival medicine seminar has.
Oh yeah, it has sounds. So we have sounds that you can hear the breathing.
Right,
yeah.
Right. We have all sorts of USBs, on our website.
I have two USBs. One is a suture staple class. It has 5 different sections on it. And then one is the survival medicine. And it goes through, I have 4 main topics there. And then I added a bunch of bonus videos that actually were just our YouTube videos.
You can see me suturing. You can see me stapling wounds.
Yes.
Things like that.
And we basically give our suture staple lecture with all of our PowerPoints, but you hear us teaching it. So it's as if we're giving you the class. And then I have one on how to set up a sterile field and how to prep the patient. So anyway, there's 5 in that. And then there's survival medicine, which is kind of what he's talking about right now, all these different skills and showing the most common issues that we feel people are going to run into, and how do you diagnose it? How do you treat it? What's the long-term treatment? So that's one of the videos. Then there's also a pandemic preparedness video. And then the other one is medical supplies. So we go through all kinds of medical supplies and talk about them and why you need them on that section.
And we have all of these supplies on our store. We have an entire line of medical kits that have been designed. We pack them right here in the USA demand, on demand, and we customize them.
We pack them sometimes too.
Right. It could be us. Could be us personally. And,
yes.
And we customize different kits we've done that for fire departments, for police departments, church security.
Yeah. I've actually created different kits that I do sell now because I've been contacted by a particular community, school, municipality, and they wanted a certain kind of kit. And I'd be like, okay, well, that's actually pretty cool. Now I'll sell that kit too. So like my multi-person was created for a church. So the church security team leader got in touch with me and he's like, I want a kit and I want to be able to put it in different areas in the church to take care of multiple people. And I have this great trifold bag that folds out and has 3 sections. So I filled each section with the supplies you would need for a bleeding wound.
The exact same supplies.
Whether it's gunshot or stab or whatever for a bleeding wound. And so those can be thrown to different people who might be in different locations.
And can handle basically life-threatening bleeding,
stop hemorrhaging.
For 3 separate people in that one kit.
Nice.
So but we do that kind of thing, and this is the kind of thing that we really try to get people to realize that they need more medical supplies. We don't care if you get them from us. I mean,
just get them.
Just get them. That's the main thing, because people don't realize how much and how fast these things are going to be expended, and they have to have more than they think they need. And the reason why that it's useful to have more. I mean, if you have more, if you want to barter them for other things, you might be able to use that. But despite that, I tell people, instead of bartering things, I think that the medic for an area should freely give of their supplies and give of their training and their expertise, to the community. Because once you get known as the medic who's going to be able to help people in the area, then you're going to be so valuable to that area that people are going to expend supplies to protect you.
Yeah.
Feed you.
Because you are so necessary.
Right.
So that's how I feel about that.